Endometriosis is a chronic gynaecological condition that can affect women of all age, all race and all ethnicity. Endometriosis is when abnormal cells from the lining of the womb, which would normally shed every month and come away as a part of the menstrual cycle and the period, migrate to elsewhere within the woman's pelvis. And in fact, at times they can migrate further into the thorax and cause symptoms there. And what happens when these cells migrate is they embed into the different parts of the pelvis, such as the ovaries, the fallopian tubes, the abdominal wall as examples, and they can cause a really severe profuse inflammatory response. And how that manifests to a lady is that every month she can have a really severe flare-up of pain when she has her period. And the periods can be typically a lot heavier than you would ordinarily expect. And one of the problems with endometriosis is, as females, we generally don't discuss our menstrual cycle very often, and there can be quite a lot of embarrassment and shame. And so when a lady has these symptoms of severe heavy period pain, it's difficult to ascertain whether that's a normal experience or whether that's what everybody else happens. And so diagnosis of endometriosis is really pretty slow at times, and the average time from diagnosis to first symptom is 7 years. And that's pretty awful, because that means for these 7 years, ladies are experiencing this really severe pain with heavy menstrual bleeding. And all the associated problems with difficulty attending school, difficulty attending work, that it can cause, and a huge impact on somebody's life. The mainstay of treatment for endometriosis is usually through sort of gynaecological hormonal manipulation or potentially surgery, and that's great when it works. But the problem is often that this profuse inflammatory response that the endometriosis can cause an upregulation of the nervous system and can cause a lot of severe neuropathic pelvic pain. And that pain initially starts off around about the time of the menstrual cycle, so when you're bleeding you can have really severe pain, but then it can start to develop to the rest of the month. And so people who have endometriosis and chronic pelvic pain often have a chronic background pain, and they can have a severe flare-up of their pain when they have their menstrual cycle. And that's difficult because no kind of surgery will treat that neuropathic chronic background pain, and no kind of surgery will treat that severe flare-up of their pain. All too often we find or meet ladies who've had their endometriosis treated, and they've had all their hormone preparations, and they've had all their endometriosis treated by surgery, and yet they still have ongoing pain, and that causes problems for everybody. So that's where the role of a chronic pain physician is really important, because at that point in time, and probably even ideally before, we need to look at other mechanisms to manage that pain. And there's special painkillers that can be helpful in using that, and they are anti-neuropathic painkillers, so anti-nerve painkillers. And they specifically target the overactivity of the nerve, which has been caused by the endometriosis and the profuse inflammatory response, to try and reduce that irritability of the nerve and settle the pain back down to a much more manageable level.